here in Madison. And subsequently, I practiced emergency medicine for about 35 years. I did an internship at Cook County Hospital, and I practiced at university as a flight physician, but also numerous small hospitals throughout the state. I was ER director at Berlin Hospital for a while, and the last place I worked was Sauk Prairie Hospital for the last 5 years of my career. I did an integrative medicine fellowship at University of Arizona with Andrew Weil about, I think it was 2008 and 2009. And so they give you a general introduction to herbal medicine, acupuncture, traditional Chinese medicine, Ayurvedic medicine, hypnosis, nutrition, as well as homeopathic medicine and manual medicine. So once I got an introduction to all those things, I wanted to explore more things in detail, and one of the things I decided to study more was acupuncture. My experience in the emergency department was that a lot of people were coming to me for chronic issues that we could help with symptoms, but there wasn't really necessarily a good cure or a good solution. A lot of people would come in with neuropathy, pain, and the medications can alleviate some of the symptoms, but I found that acupuncture, I have 20 some odd people who couldn't feel their feet, who now can feel their feet. And it becomes much less of a fall risk. Their balance is better. Their strength is a little bit better. And they seem more confident in walking. There's so many things that acupuncture can do that address that Western medicine doesn't address very well. I'll be coming here on Tuesdays. I guess the first and third Tuesday of the month. There's a foot care clinic in the morning, so I'll be seeing people in the afternoon. I can see on the second and fourth Tuesdays, I'll be here the entire day. I also see people at Verona Senior Center and at Wanakee Senior Center, and I have an office at my home, in my lake home, which is on Lake Mendota near Governor Nelson State Park. And I see people any day of the week. If Tuesdays here aren't convenient, I can see you at my home office, or I also do home visits, mostly for people who've had strokes or just post-surgical, if they've had knee replacement or hip replacement surgery. Acupuncture can help you recover faster than without it. A lot of people will see me for chemotherapy symptoms, and it helps alleviate the nausea, and people generally feel like they have more energy and more strength. The most common things people come to see me for are musculoskeletal, hip, shoulder, back, and knee pain. And usually people ask me how many sessions does it take, and it varies. Some people, the pain will be gone in one session, but in more chronic back pain, it usually takes 10 to 12 for people to start getting a good amount of relief. I generally see people once a week. The type of acupuncture I do is additive. If I see you fairly close together, if we wait a month or so in between, it's almost like starting over again. So I like to see people regularly. If you have an acute injury, I usually like to see people a couple times a week at first. And mostly I'm just here to answer questions today, so I'll just add anything you'd like to know, I'll try to answer. Go ahead.
I'm just curious mostly. I've done acupuncture, cranial sacral, energy healing, and everything has kept me pretty good. The trouble I've always had in traditional medicine are the doctors. I've come to dislike them intensely. Because they'll listen, they look like they're listening, but they're not. They've got an agenda, and as soon as you stop talking, now they can start. And I firmly believe in what you're doing. But it amazes me that an MD could transfer into acupuncture and the different alternatives you're into. Whatever made you really make that leap, or is it because you're retired that you could easily go there?
Well, I've been practicing acupuncture for 11 years, and I even practiced in the emergency department.
And they let you?
Well, the administration didn't like it, but I said it's in my scope of practice, and people were generally very happy that that's what I was doing. So what made me, I think it was just sort of my history. My grandparents were immigrants, and so they brought a lot of herbal medicine, and so I was accustomed to getting treated at home rather than going to a doctor. And so this is just sort of the way we did things, I guess. And the main reason is there's just so many, once you practice for a few years, you just realize there's a lot of things that Western medicine doesn't address adequately. And part of it is how things are financed. The drug companies drive a lot of it without you realizing it. When I first started practicing, they allowed drug reps to come and talk with everyone, but they sort of cut that out because they found how influential it was. But it's still very influential, and a lot of studies don't get done because there isn't a big drug company behind them. There is getting to be more and more acupuncture research, but there's a lot of difficulties with it. One is that it's difficult to do a control. They do have this device. They just like tape a block to your skin, and you can't really tell whether the needle is going in or not. But the problem with that is that just even having the block on your skin over an acupuncture point is influential, because you can stimulate acupuncture points with needles, with light, magnets, heat, massage. All of those things work. And so do you really have a control, or are you actually treating the person also? And sure, yes. I believe it's downstairs where foot care is and massage. Yes.
What do you charge?
$70 a treatment, and $7 goes to the senior center. If there's two of you together, I'd prefer that you know each other and you're okay talking about whatever issue you have. Then I'll take 10. It'll be 63. I'll take 10% more off, and I still give the senior center $7 or whatever. My price has been the same for 11 years. I haven't really gone up.
When you do 2 people, you might work on 2 different problems, one with one,
Yeah,
one with another.
yes,
But at the same time?
at the same time. And I have enough room in that room for two beds, and at my home, and sometimes when I do home visits, I have 4 portable beds, and I can sort of treat 4 people at once. But yes, but it has a nominal effect. I think it's 7. If your systolic is 130, it'll bring it down to 123 or 122. It's not a huge amount, but in general, you're trying to balance your sympathetic and parasympathetic nervous system, and that has a lot of other benefits. People generally feel very relaxed when they're having a treatment, and I'd say 6 out of 10. After people have seen me a few visits, I'd say 6 out of 10 fall asleep during the treatment if I'm not chitter-chattering the whole time. So I think that's one of the benefits that you were mentioning before. Physicians have an agenda, but a lot of it is driven by, we have to get out of there. You're only given so much time with everyone, and even though we want to see, you only have time enough for so many, to solve so many issues each time. And not an excuse. None of us like that, to having to rush. But the one thing is I can spend an hour with you and you can ask me whatever you want. And if I don't know, I know a little bit about everything, but some things I just don't know things in depth. But I'll look things up for you if you have questions about Western medicine or traditional Chinese medicine. Yes?
Just in a nutshell, what is the theory behind acupuncture in terms of various problems, injuries, whatever? For example, shoulder impingement. What would the theory be to alleviate some of that?
There's several theories on mechanism of action of acupuncture. One is that it acts on your mesodermal level. When we develop in the womb, there's ectoderm, endoderm, and mesoderm. Your mesoderm ends up being what covers all of your organs and muscles. And it turns out that there's more nerve endings and sensation in that level than even your skin. And one doctor described it as it almost works like liquid crystal. For instance, there's a point on your foot right by your big toe, and I'll usually check your scalene muscles up here. That point relaxes the muscles in your body, and when I put that needle in a very tall person, it'll take the count of 2 or 3 for this muscle to relax. But a shorter person, it's almost instantaneous. So it's almost like it works as a liquid crystal. So it's affecting the mesoderm. The other more well-described theory is that it's a neurohumoral effect. So around each acupuncture point, they found that there's usually a nerve associated and a vessel. And in animal studies, they've labeled some of the molecules that get stimulated by acupuncture with dye. And when they put a needle in here, for instance, on an animal, and they have the labeled molecules in the animal's bloodstream, you'll see that this area, for instance, if it's blue dye, this area all the way up here turns blue. And so by stimulating that point, you're stimulating chemicals that have effects throughout the body. And so I think there's mechanical effects and neurohumoral effects. And the summary that they gave, I did my acupuncture at Harvard, and I did an advanced course, and I also did a course in Japan. And they said the mechanism still isn't delineated, but what I've been impressed with is how many things acupuncture helps. And to me, it doesn't matter how it works as long as it works. They've been using it for 5,000 years in China and shortly after in Japan. And the style that I use is mostly Japanese style. So I'll palpate your abdomen and neck, and that tells me about where the acupuncture point should go. The one thing I like about acupuncture, it's really intuitive. It just seems like my hands go where people need to be treated. And I did medicine that way, which made people really mad because I wouldn't do all the tests they wanted. And it's just like, you don't need it. I already know you have this. And acupuncture actually fits my personality a little bit better. So, yes.
Okay, everybody shut their ears. I'm going to talk about incontinence.
Uh-huh.
I don't like to admit it, but there's problems, and what's your success ratio?
I have only. That's one that's been coming up more lately because I'm working with an older population, and so I have 4 recently in the last 6 months, and everyone's gotten better. But that doesn't mean everyone will, but everyone, it depends how mechanical it is where your uterus is and everything and what's pushing on what. And because sometimes you actually do need the physical repair, but everyone has told me it's better. And one woman said, oh, this is life-changing, and so, and that was just after 2 treatments.
Oh my God. I've heard that, except for the people with physical illness, but I've heard that mostly it's just brain centered. It's a reflex in your brain, and it doesn't have to be that.
Yes. And you, oh, go ahead.
When you say it's gotten better, does it mean it's fixed, or does it mean?
Yes, the first one, yes, 3 out of 4 are totally fixed, and 1 who was going multiple times, it got down to once at night. So.
Sign me up.
Oh, and you had a question?
Yeah, I never got acupuncture, rudimentary understanding. I always thought that it was sort of a freeing up of the energies.
Yes, usually there's like an energy blockage somewhere along your body. There are a bunch of acupuncturists who just treat scars. There's like 14 main energy channels. There's 3 on this side of your arm and 3 on the other side, and 3 on one side of your leg and 3 on the inside of your leg, and 1 that goes up the middle and down the back, and another that goes down the back. And when people have an injury, even in the distant past, even as a child, sometimes there'll be a scar across one of those channels. And if that scar is painful, you'll treat the scar. There's some acupuncturists that just treat scars, and it fixes endocrine problems, physical problems. It's just sort of amazing. You wouldn't think of it. And they even treat injuries that might have occurred at birth for some conditions. And so. The mesodermal level. Yeah, it's just your fascia, basically. Yeah. I just lost something. I had Alzheimer's. I can't. I was going to say something else, but oh well, it'll come back in about 15 minutes. Yes.
What about depression or insomnia?
That's been real common. Especially since COVID, a lot more anxiety, and a lot of people tell me it helps quite a bit. And I'd say probably 15-20% of my people are coming to me for sleep. Yes?
I have shaky hands.
Yes.
And it's genetic. I'm not
For essential tremor, I've tried on a few people. I have better luck with Parkinson's, decreasing but the studies that I've read, the amplitude is less and it occurs less after treatment, which is what a couple people I treated found. But it doesn't, in general, I haven't found anything that says it goes away. And that's been my experience with the few people that I've tried. But it does get a little bit better and a little bit less frequent. But I would say it's not going to be curative. Yes?
I have candidiasis.
Mhm.
What could you do for that?
Probably would address it more herbally than with. I would probably address it more with herbal medicine than with acupuncture. But there are points. There are 6 to 10 main points that you use to stimulate your immune system too with treatments, and then that can help too. A lot of people will tell me when they go on, I have a lot of snowbirds, and when they go away on vacation, before they go away on vacation, I'll be treating them, and they'll be exposed to all these sick people, and they don't get ill, but then they go on vacation, and they haven't had acupuncture, and they do. So I there's plenty of studies that show if you, for instance, if this point right here, large intestine 10 and 11, when I feel like I'm coming down with something, I actually just massage that point, and it's been shown to stimulate your different kinds of white cells and make them more active. And I found that if I feel like I'm coming down with something, just massaging those points, the symptoms just go away. So, yes. Go ahead. Yes.
Do you take Medicare or is it?
I don't. The Medicare only covers if you have chronic back pain, and it's so much documentation. When I've tried to do insurance, I have spent more time negotiating with the insurance company and calls and 4 or 5 different reference numbers, and even when I fix someone and they've paid thousands more for people that didn't help their problem, and even though I fixed it, they tend not to reimburse very readily. So it's $70 a treatment. And in general, I think the cost around Madison is a little bit higher. It's usually $100, $125, and I know a few people that are charging $200 or $300 a treatment. And as I said before, I'm still charging about $70. If there's more than one person, then I take 10% off. Yes.
Can acupuncture help things that are sort of cosmetic, like spider veins or heavy bruise or something like that?
Not spider veins. A heavy bruise, I would just use like arnica or something like that. That'll make it go away a lot faster, days faster. I have to look up spider veins. There are cosmetic wrinkle treatments, and you use these really fine needles and go along the wrinkle, and it stimulates some cell growth so that there is less strong appearance of the wrinkles. They sell a lot of cosmetic supplies, acupuncture supplies. If people are interested, I can do that kind of treatment.
And also, the wristbands that are used for motion sickness?
Yeah, that's stimulating pericardium 6. Most people have like 3 superficial tendons there, and it's just on the thumb side between the 2 most superficial tendons. Yes, same thing with the low back pain. There's several chiropractors that I've seen on TV that sell a band. That pushes back here on your knee, and that's for low back pain, because that stimulates a bladder channel point. Yeah. Oh, and you tried. Yeah.
If you have several problems like allergy, high blood pressure, bladder problems, do you treat that all at the same time?
I do it all at once. My instructors probably wouldn't be happy with me, but I tend to do more than one step at once, and everyone that's seen me practice that does acupuncture themselves has said my style is very gentle, so I tend to get away with it. So I treat more than one. Whatever you tell me, because usually people will come in for one thing and then they'll find that it's fixing a bunch of other things. But
So like how many needles do you put in usually?
it varies. It's a minimum of 10 usually per step, and I'll usually have people face up at first and then face down the last 15 to 20 minutes. And yes.
How long do the sessions last? The average?
An hour. I give everyone an hour. The needles, the longest time the needles have to be in are, some people say 20, but my instructor said 30 minutes, and that's for your the deeper channels in your body, the kidney channel, they have to be in at least 30 minutes. And I like to make the treatments a little bit longer because I'm just seeing people once a week instead of 3 times a week or something.
Do you make appointments with you, or do you call them?
With me, because then I can answer questions. And one of the other senior centers they were booking people together that didn't know each other, and I don't want that to happen. So, yes.
So you're going to work out of a room here.
Yes.
Do you ever
Yes, I do. I have my home office is on Borchers Beach Road in Wanakee, Westport.
So if we want an appointment, it doesn't necessarily have to be here?
Yes, I'll see people any day of the week. I usually will see a few people on the weekends because that's the only time they can get over there. My schedule currently is I'm at the Verona Senior Center on Monday. I've got the whole day, but usually there's just 3 to 5 people. On Tuesday, I'll be here in the afternoons on the first and third Tuesday of the month, and all day on the other days of the month. And I'm at Wanakee on Thursdays. I usually have, that's a little busier. I usually have 7 people there. And Friday, I don't schedule anything outside of my home, so I always have appointments on Friday or Saturday or Sunday. I sort of try to keep them in the early morning or mid-morning or later in the afternoon on those days so I can get out in the middle of the day for a while. But I'll see people any day of the week, and I do home visits. Yes?
Since you don't work with insurance companies, I mean, would you present the person with a bill and make it present it to their insurance company?
Yes, I will fill out a form for you. I can put in the codes, the codes for what I do and the hours. I've had a couple insurance companies that are really good about replacing, but I've also had some bad experience, like with Humana. It took. That was my insurance company, so I haven't had anyone apply, but I guess they do have some. Will reimburse for some things depending on the policy.
So do we pay at the end of each visit?
Yeah, some.
Charge?
I don't, but I'll do Zelle because I'm sort of budget and I don't want to do an awful lot of office work. So I just do cash or check, but I'll do Zelle, and I probably could do PayPal. Yeah. I don't, just because they charge 2 or 3% for everything, and so yes.
Another personal problem. I have arthritis in my hip,
Mhm.
and I will have muscular pain running down the outside of the leg,
Mhm.
the upper part of the leg, the inside of the leg, by my crotch. And it's never the same.
Mhm.
Sometimes this muscle hurts, sometimes this muscle hurts. And I tried PT, that didn't help at all. So, any hope?
Oh yeah, this will help, but I give people a lot of homework to do too. So I have people use foam rolls and rolling pins and massage, and I have some yoga stretching exercises that I have people do as well, and you can modify all those depending on what you're able to do. So I usually I use a lot of different modalities. I'll probably use a couple things that you think are very strange, like people. There's a couple treatments for neuropathy that don't look like they would ever work for anyone, but I'll be wrapping you up like a Thanksgiving turkey in aluminum foil. But if you have a neuropathy, there was a Japanese acupuncturist who's also a physician who was stationed in the Pacific Islands during World War II. I think it was Dr. Nagano, and he ran out of bandages and supplies to dress wounds, so he started using aluminum foil because that's all he had to cover the wounds. And he noticed that the soldiers who were near radio equipment that had stray voltage, back then they just had the radios with tubes and et cetera, and there was a lot of stray voltage coming from those from that equipment. He noticed that the soldiers who had aluminum foil on their wounds and were near that radio equipment, their wounds healed faster. And so he designed this little device called a Pachi Sparker. And so I'll put a diode chain around your leg, and then there's some electrodes to attach and cover everything with aluminum foil, and then spark the device on the aluminum foil. And they think it might be because you're creating a layer of ozone underneath, but you're also altering the way your body current goes. But I've been the most remarkable person I had with neuropathy, it took a year to finally get her to feel her feet, but she had had chemotherapy for a muscle tumor in her leg 15 years before I saw her, and could not feel her feet for 15 years. And each week as I was doing that procedure, I got about a half a centimeter further down her leg where she could feel, and at the end of a year she could feel her feet. So I've had between 20 and 30 people, the same thing happened using that, as well as there's points to use in regular acupuncture too, but I'll use things like that. I have these diode rings for allergies that I'll put over people's sinuses, and you'll notice if you have pain in your sinus, say it's 8 out of a scale of 10, in 15 minutes it'll be 3. And I've had people with, in fact, my brother-in-law, he drove from Illinois to see me 3 times for his allergies because he was taking 21 doses of medicine a week. And after 3 treatments and using the diode rings at home, he got it down to 3 doses a week. So I've seen it be pretty effective. I have some pretty remarkable things. One of the nurses I worked with who had sciatica, she said she had it for 9 years, and she let me try acupuncture. And I put 1 needle back here, which is a lumbar point, and she had it in for an hour, and she didn't have pain for 9 months after having it for 9 years. So that was like my best 1 needle cure ever. Yes.
How do you deal with people on blood thinners?
It doesn't make any difference. The needles are so fine. These are like 0.18 millimeters in diameter. So they're very tiny. You have to put them in with an introducer tube. And the most I'll ever get is like a drop of blood. But if I do happen to hit, because I go through clothing, because especially in the winter, I don't want everyone to have to take everything off. Sometimes I will hit a little capillary and you get a little bruise. But it's no different than you bumping your arm or otherwise. But they always say ask about it, but I've never had any problem with it except a few bruises here and there. So, yes.
I'd just like to respond to your question. You may have already said it, but I've had acupuncture in the past, and I don't even feel when the needles go in.
Yeah, I'd say most people don't. There are some people with where their nervous system is sort of hyper, like fibromyalgia. Those people tend to feel more needles than average. They'll feel 8 out of 10 the first time, but after they've been coming to me for a while, you end up just feeling 1 or 2 out of 10 maybe, and usually it's just a quick prick, and then it goes away. And like I said, it's a relaxing experience for most people. They'll just fall asleep. So, yes.
I get anxious a lot, and I'm on some, I forget what it's called. It's a tincture called impatience apple flower, the Bach flower essence.
Uh-huh.
I take that, and that really works. But before I go see a doctor, anybody, in authority over my body, I tend to meditate. I'll go early to the waiting room, and I'll just really try to get into this zone of lowering my blood pressure, trying to be calm. Do you recommend doing that with this, or?
I don't think you have to do it in advance unless you're tremendously needle phobic, because just the procedure itself usually relaxes people. People will come in and say that they'll feel stressed in the beginning, and then there's totally different reactions. Some people get really, I have a couple people that come to see me and they get really giddy because they feel so good afterwards. So generally generally, people are more relaxed at the end.
Okay, I haven't had it done in a long, long time.
Yeah.
What bladder problems would people come to you for?
Well, incontinence is the main one. Yeah. That's the main thing they've come to me for. Yes.
If I have 3 or 4 different problems, do you use your intuition to decide what to do first?
Sometimes yes. Sometimes I'll just do a little bit for everything, but sometimes I'll find that it's all along the same channel. Multiple things have to do with the same energy channel, and so sometimes yes, sometimes no. Yes.
Another personal problem. When I was researching what to do for this hip problem, I researched bursitis. And this was Mayo Clinic site, and I'm reading down, and at the bottom it says it can affect the bottom of the big toe.
Mm-hmm.
And I said, well, that's one of my problems, the big toe. When I
Yeah.
hurts, the bottom of it.
Mm-hmm.
Can you help bursitis?
Of course, yeah. I should have you talk with someone I just finished treating at Verona, because he was really skeptical, and he and his wife came in. He worked at the State Lab of Hygiene, and so I had to describe so he was a scientist and doing research all the time, but I just saw them yesterday, and his bursitis is all gone. He had trochanteric bursitis, greater trochanteric bursitis as well. And the reason it affects your big toe is because your sciatic nerve comes out just between 2 of the big muscles in your butt, and that can cause enough inflammation that it's irritating the nerve. So.
And on that note, I had the opposite, where I had a foot injury 2 years ago, and on track to foot was not, but then the pinching, but then different exams and MRI, to finally that it was probably a bursitis,
Mm-hmm.
but it does not really, and then the opposite, so it's the bottom foot pad, and then now, for the last 2 years, it's radiating, it's like all the charge up sideways, and the whole thing now.
That seems to be very common, and everyone's getting better so far. I think if you stick with it, you'll see some improvement, a lot of improvement. So, and what was interesting about learning acupuncture is that the title of the course was International Structural Acupuncture Course, and with the emphasis on structure, because the alignment of your ankle, knees, hips, even your hyoid bone here can affect your pituitary gland, the alignment of your bones in your skull. And so sometimes when they're treating for something in your head, you're actually aligning your ankle to make a change. So and a lot of times with the moving pain, it's just that without realizing it, you're slightly altering your gait to have it hurt less in one direction, and then you're using another muscle, and then that one hurts because you're overusing that one, and so I've just been going through that myself. I just tore my meniscus a few weeks ago. I still haven't had an MRI, but every day it's on a different side of my knee depending on how I walked the day before. So.
Can you do acupuncture on yourself?
Yep. Yeah, actually, I was hurting yesterday, and I was treating 2 people, so I did a 10-minute treatment on myself, and the pain went away. So I'm just in the middle of it. So yeah. The big problem with doing it myself is usually I wait till the end of the day and I put them in when I'm in bed, and then I wake up and the needles are all over the place in the morning. Yes.
Divvy's on the first appointment.
Oh. Yes.
When will you start coming here?
The first Tuesday in May.
Okay.
But I'd be happy to see people any other time as well. Yes.
I wonder if you could talk a little bit about the difference between acupuncture and acupressure. And do you ever teach people to do acupressure to themselves? for
Yes.
chronic condition?
Yes, so it's just a different way of stimulating the acupuncture points. Sometimes I'll even have people use like a laser pointer, and if you just use a laser pointer at that spot for a minute, it's the same as doing pressure or a needle or a magnet or heat. Sometimes I'll give people a little device to apply heat at home. I've used that for the most common time is when I'm doing I've treated a couple of people who couldn't get pregnant, and I've only had a handful, and one got pregnant after the first treatment, but I figured this population probably is not at this point, so yes.
I thought you said you came here second and fourth Tuesdays.
And the first and third, I'm here in the afternoons because there's foot care in the mornings. I found out they're here till 11:45, so I'd be doing my appointments on the half hour, so 12:30 to 1:30, 1:30 to 2:30, and in the morning I'll start at 8:30.
So to make an appointment, we just call this number.
Yes.
Comes back, okay.
Or just text me what your availability is and what day you want, and that you want to be seen here, and if yes.
Are you able to help acupuncture on hammer toes and bunions?
I can help with the pain, but I'm not going to probably change the architecture. That's more surgical. But a lot of people come to me after surgery and before surgery with people with chronic hip pain and knee pain. I've been able to delay their surgery by about 3 years on average. And people find that they recover a little faster afterwards if we do acupuncture, and I can come to people's homes after surgery to do acupuncture. Yes.
On the second or fourth Tuesday you're here at the foot care.
Yes, at 8:30 in the morning, and then on the first and third, I'm here in the afternoon from 12:30 on.
So do you need to make an appointment for those days?
Yes, you either need to text me or call, and we can figure out an appointment.
Everybody in here grabs their phone. Fix the appointment right now.
Well, thanks everyone for coming, and thanks for your interest.
Thank you.
Thank you. And if you'd like to come to see me sooner, you're welcome to.